I was born in Rio de Janeiro, Brazil, and I came to America to pursue my medical education. I trained in Brazil as an internist as well as a cardiologist. And later on, when I finished that, I completed the residency in internal medicine, and then I did a fellowship in cardiologist, and I was practiced essentially as an internist. That decision, actually I was doing quite well in private practice in Brazil. Things were doing well. But to see, my mentor out there told me that I have to experience American medicine, that he considered the best in the world. And he told me that I should do that and not simply stabilize my life in such an early stage. Then I came to America, training internal medicine. Subsequently, I trained in pediatrics, and after that, I did my training in hematology oncology. But I have been here more than 30 years now, so it just becomes in the dreamland. Our duty as a physician is to take the best possible care of that human being that is in front of us. Obviously, as it has been said a long time ago, the first duty of a physician is to do no harm. It's always very important for us to balance technology, aggression, and our outcome. Very careful. It's also essential to remember that I'm working usually in an urgent care facility. My duty is to be always respectful to that patient. My duty is also to understand the needs of the patient and the cultural background of the patient. And my major duty is to try to make a correct diagnosis and do the best possible care in that visitation. But our duty doesn't finish there. Many times a lot of patients that come for a visit in our urgent care center, they don't have general practitioners that see them on a regular basis, or they have not seen the physician in a long time. So we try to be as comprehensive as possible, not only addressing the acute issues that exist at that point, but in many cases, using our duty as a physician to educate that patient or help the patient, bring to the attention that there are a number of issues related either to preventive care or taking care of chronic problems that this person has that are as important or more important than that simple brief interaction that we have in an urgent care center.